Nicole is our patient today, and Ashley, who is our AAFE faculty member, has been treating Nicole, and I just wanted to show you close up what is going on here. And what we've done on her are solid filler smooth PDO threads here. And what that means is, imagine that you have a dermal filler that's in solid form, little thin strips or threads of this filler here, and I'm just going to turn you this way just a little bit here, and we've covered this area. Why did we cover this area? For a couple of reasons. Number one, she had pretty bad acne scarring in this area, and number two, that's going to go ahead and really build collagen in this area, new vascularization, neocollagenesis, and you can see after 2 treatments, this is going to be her 3rd treatment, after 2 treatments, her skin is really smooth, much better than what we started with. I mean, really significantly better, but it's also built up her cheeks here because, you know, these treatments are about 1 month apart, so about 3 months later, we are already in the area where she's really built quite a bit of collagen and have really defined this zygomatic process and this nice high cheekbone that she has, and really defined this quite well. So everything that's supposed to happen with solid filler PDO threads has happened, and we're going to go ahead and continue that on. Let me show you the other side here too. And here, same thing, huge improvement, even though we've still got a little bit of ways to go, huge improvement in her skin texture, in the smoothness of her skin, and I know that you've noticed a big difference there too. You tell me a little bit about what you had done prior to getting these treatments for skincare, and has it worked for you or not worked?
I've tried every skincare product, over-the-counter, prescription, and nothing worked. I've been on every, oral medication and topical medication, and nothing's worked. And I got the threads, and it was like immediate results.
Right, and that's great, and it gets better over time. So 2 things happen when it comes to PDO threads. You get that immediate visible result, and then over time, because as you'll see, when we put this mesh underneath her skin, you get that structure immediately, but as these threads, these PDO means polydioxanone threads break down, you get that neocollagenesis, new collagen, new vascularization, and literally, new skin, and that's really what's done a great job for Nicole. So now we are on our 3rd and final visit for PDO threads, and we're going to have Ashley go ahead and go ahead and accomplish this, and we can show you how we're going to go ahead and do this. And let's turn her, if you want to turn her this way a little bit, that'll make it a little bit easier for the camera here. And she has had a ComfortTox BLT-like substance on her on the skin for about 15 minutes. And again, she may feel a little bit. This is all about great technique, which you're going to see Ashley accomplish here, and that's what makes it a fairly comfortable procedure. Patient may feel a little bit here and there, and Nicole knows what to expect at this point here too. So go ahead and Ashley, whenever you want to jump in, we'll let you jump in here too. She is using, I think, a 29 gauge by 30 millimeter thread, and just going to place it in there. What is crucial in placing these threads, it is all about the proper depth, and that depth is really the subdermal space between the dermis and the subcutaneous tissue underneath it there, and that's really the place that has got the least amount of vasculation, the least amount of neurostructure, which makes this fairly comfortable for the patient. Again, there might be a couple of pinches here and there since we are using these threads here. And then these threads are designed to go in here, and you can see Ashley placing them, and she's going to place kind of like a mesh, as you can see her place these. These are very quick and easy once you learn how to do these. And what it requires is great training and knowing where to put these threads, how many threads that you're going ahead and actually put into there. And you want them really sharp. And this, these are AAFE threads that we've chosen for our course. There are many, many threads out on the market. These are by far the best. They are the most comfortable because they do use ComfortTox technology in creating the sharpest tip, which means they're going to glide in the easiest, and they are about 20% less expensive than just about anything else on the U.S. and North American market here. And how you doing, Nicole? You doing pretty good? Yeah, great. Nicole is definitely a trooper here, and that she is doing really just great. We're going to, after this one, we're going to turn you just a little bit more. may not be the best angle for Ashley, but it is the better angle for the camera. So Ashley has learned how to twist and turn herself. But definitely when you do this, part of the great technique in doing this is making sure that you, as the operator and as the clinician, are more comfortable with being able to access what you need to access here. But you're doing great. Hang in there, Nicole. And the way Ashley bends the hub, the way that she accomplishes all that, knows when to straighten out, that's all about getting in the correct plane for this. And these can all go in at one time, as you see. They can all go in and they can go in one at a time and have them taken out. It really doesn't matter. It really depends on you, the operator, for all of those things. So that is looking really good. The last one here, Nicole, you're doing just great. But even if she feels it a little bit, we try to make it as comfortable as possible. Even if she does feel it a little bit, it's been well worth the results, right? I mean, it's definitely been worth the results for that. So now we're going to go ahead. You ready to take these out? Okay, the way you take these out is you are going to turn these 360 a couple times just to make sure that the thread now engages in the tissue, and we want it to stay in the tissue. Come straight out. You can take these out fairly quickly. There's no point in taking them out slow. And now she has got this mesh right underneath the skin. And again, that's what's built up this hole. I mean, she's had a cheek enhancement with solid filler PDO threads, these smooth threads. And we've seen it now over time. And patients are willing to wait for great skin and also a great cheek enhancement just with these solid filler threads here. So now at this point, it's just a matter of cleaning her up, and then she gets instructions for all these. Since this is a fresh site, we don't want her to put on any old junky makeup that is bacteria infested or anything like that. Just keep it clean for the next few hours. She can put on very, very light makeup if she needs to. So that is a great, simple, easy treatment of solid filler smooth PDO threads. These are smooth. Difference between these and lifting is that these are perfectly smooth. The lifting threads actually have little barbs on them that can pull up. That's not what she needed in this case. What she needed is just to create that immediate structure underneath her skin. It'll break down, cause collagen, cause the body's natural collagen release, and build this area up for that. So you did great, Nicole. One other treatment down.
Yep.